Now that we have learned about resistance, let's apply that to blood pressure. There are two main factors that affect blood pressure. They are blood volume and peripheral resistance. When blood volume increases, blood pressure increases as well. So the more blood you have, the greater the pressure. When peripheral resistance increases, it also increases blood pressure. Peripheral resistance is the same as the resistance that we studied earlier. The only reason we call it peripheral resistance is because we're dealing with blood vessels that are periphery to the heart. So when blood volume increases, blood pressure increases as well. When peripheral resistance increases, blood pressure increases as well. If you remember, there are two major factors that affect blood pressure. They are blood volume and peripheral resistance. When these two factors increase, blood pressure increases as well. The sympathetic stimulation increases both these factors and thereby it increases blood pressure. So let's take a look at what happens in an emergency situation or when you are exercising. The sympathetic stimulation increases. So there is the up arrow, increases. It activates the arteriole and the heart. So there's the arteriole and there's the heart. It has a positive effect on both, so we'll put the positive sign there for the arteriole and for the heart. When it acts on the blood vessels or the arterioles, it causes vasoconstriction. We must remember that the sympathetic stimulation, when it acts on the arterioles, it causes vasoconstriction in all the blood vessels that are present in the abdominal region of the body. That's where most of our blood vessels are present. So when vasoconstriction increases there, it increases peripheral resistance in general. So that increases blood pressure. Now the effect on the heart. We know that sympathetic stimulation raises the heart rate. There's your up arrow showing that heart rate goes up. When the heart rate goes up, the cardiac output increases as well. When cardiac output increases, blood volume increases as well. When blood volume increases, blood pressure increases as well. There is another way in which the blood volume increases, and that is via contractility. If you remember, sympathetic stimulation increases the contractility in the heart muscle. So when contractility increases, stroke volume increases. There's the up arrow for stroke volume. And when stroke volume increases, cardiac output increases, which increases blood volume and increases blood pressure. As we can see, two major factors: when peripheral resistance increases and blood volume increase, blood pressure increases as well. The opposite happens with the parasympathetic stimulation. You may have experienced that your blood pressure goes down when you are in meditation or when you're sleeping or doing breathing exercises. So let's see how that happens. When the parasympathetic stimulation increases, it affects both the arterioles and the heart. So the parasympathetic stimulation increases. There's the arteriole and here's the heart. It has a negative effect on both. On the arteriole, it causes vasoconstriction to go down, which means that majority of the blood vessels that are in the abdominal region dilate. So when vasoconstriction goes down, peripheral resistance goes down as well. When the overall peripheral resistance goes down, blood pressure goes down as well. Now for the heart. The parasympathetic stimulation lowers the heart rate. It does not have much effect on the contractility, but it does lower the heart rate. When the heart rate goes down, the cardiac output goes down as well. When the cardiac output decreases, blood volume decreases. When blood volume decreases, blood pressure decreases. So there we have it again. Peripheral resistance and blood volume influencing blood pressure.